So good morning, everybody. Again, I do want to start off by thanking our men and women that are on the front lines, our police, our firefighter, our EMS, our nurses, our doctors, our LPNs, our certified nursing assistants, and the workers in the hospitals in general that are the backbone of that hospital that keeps it running, from the janitors to the maintenance, the security, to everybody. Because without everyone working as a team, the hospitals wouldn't run, EMS service wouldn't get out there, to our dispatchers that do a great job. Thank you, thank you, thank you, and especially thank you to the workers of Albany County that have to come to work every day, have a mission that they have to complete, and have to continue to be out in the community to check on different things or make sure people have their vital services that they need to continue on with life. We just don't shut down and walk away. It doesn't work that way, and that's what government's here for, to help work. I want to commend our elected officials that have been out there doing stuff. Sue Rizzo, our controller, Sheriff Apple, Bruce Hidley, our clerk, David Soros, our DA, who, we have to continue to work. We have to continue to function. And it doesn't happen without working together. So I want to thank everyone first and foremost on that. And again, as testing has been limited, we've been trying to work on that, and hopefully we'll have something in the near future on that. But we are up from yesterday. We're at 187. Today we are at 199. So we're at 199 on the cusp of hitting 200. Our under mandatory quarantine went up from 505 yesterday to 559. And our people under precaution quarantine actually dropped from 233 yesterday down to 223. And you got to remember, I want to thank our Department of Health in Liza, Whalen, all the staff down there, Mary Beth, and all of them that have been doing a great job, and not to the administrators, the people volunteering on the phones, the people volunteering in general that have been going down there, and the workers that got reassigned down there from other departments doing a great job. But they do the mapping and they do the tracking, and it takes time. So we try to do our best to get as much information as quickly as we can to make sure that's happening. So we have 15 people in the hospital. 7 adults were in ICU, and as you can see here in the graph, the numbers of positive cases still continue to climb, and will continue to climb in that direction. Something that reminds me, you got the village here in Albany, and they always got their quote, and it reminded me, it takes a village to take an entire community to respond to a crisis like this. And we've been seeing so much compassion and selflessness lately. It makes me proud to be the county executive of this county. That people, not just businesses, are stepping up and doing things differently, that the people of this community are actually pitching in and trying to help and trying to do great things. So in essence, I can't thank you enough for that. So it does take a village. It takes a village to raise a community. So thank you so much. Our regional food bank of Northeastern New York, we had over 19,000 pounds of food shipped into the Times Union Center today for families who have been placed under mandatory and precautionary quarantine. This includes pasta, peanut butter soup, canned vegetables, rice, pork, chicken, and apples, eggs, and more. And we had the New York National Guard and Air National Guard helping out with us, and we can't thank them enough. And to our TAG, General Shields, that's doing a great job for us here in New York State. Thank you, General, for everything that you're doing. Thank you to all the Guard members that have volunteered to step up and go out into the community, not just here in the Capital District, but through the whole state, and especially downstate, to get them ready for what's coming. Yesterday, we discussed the number of businesses who continue to serve publicly in houses despite the governor's guidelines. Did talk to the SLA today. We did identify that, and we're working with them. Like I said, I'm not here to embarrass these companies. We're here to make sure that they stop and assist people being at the bar. which we addressed yesterday, and I would imagine after the press last night and today, that's not going to continue on. But it takes away from the businesses that are actually out there doing their job, keeping people working, and providing a vital service to people here in the county to order out food, to break away from being home all day, to have a nice meal delivered to them. So I would say 99% of the businesses here in Albany County are paying attention to that. So thank you for what you're doing. Can't thank you enough on that. So we know businesses are having a tough time. And I mentioned the other day to go to the Small Business Administration website to file an application. One of the things that we did was I sent a letter to the governor with other county executives from across the state of New York, and we requested to change the way our IDAs do loans, because at a time when businesses really need the money now and not later, we addressed this with the governor, and I got to say the governor got back to us quickly, and they're going to let IDAs and I believe CRCs to give out not just quick loans, but to give out grants to keep these businesses going. I'm reaching out to the chair of the legislature, Andrew Joyce. We reached out to Bill Clay, the chair of the IDA, Gary DeMolowitz, the chair of the CRC, to basically get this program rolled out quickly through our economic development person, Kevin, to make sure that we can get the money where it's needed. Now, you say, why is that important? Companies are shut down. Now, non-essential employees aren't going back to work to April 15th, and, we got a plan past April 15th. And what is important is that they're trying to keep people working, and some people live check to check. They're having a hard time not even just paying the rent, but putting food on the table, and we need to address that quickly, and we need to have relief. And the reason why I bring that up, because if you look at the SBA, the Small Business Administration, I talked to a couple companies that filled out their applications, and they said it took us over 24 hours to fill out an application, and we got it in there, and the SBA has over 25,000 people that applied. How quick are they going to move? How quick are they going to get through the red tape to get the money in people's hands? Because people need the money today. They don't need it tomorrow. They need it today. So that's one thing we're trying to address through all this, is make sure the money gets there quicker, in their hands, out into the community, to get people be able to just buy food. So that's one thing why I think, and I commend the governor again for the IDA, because this is going to help us be a little bit quicker to get money out there, to keep these businesses going, maybe have them employ a few more people to help work out in the kitchens and get the food out to the community. So thank you, Governor, for that. We know everyone's feeling stressed, right? We know everyone in the community is anxious. Things are changing, and it's the one thing that we talk about constantly, how things are changing and how we need to address that and how we address that going forward. Look, I would love to answer all the emails we get, all the Facebook comments that we're getting, the misinformation that's out there, and that's why we do this daily with the Department of Health and Liza, is to really just get the information out there, tell you what's going on, and trying to keep the facts the way they are so people are informed and they know there's help out there, just like the mental health support line that we keep putting out there, and we did since day 2 of this, area code 518-269-6634, and it's open 7 days a week from 8 a.m. to 5. And look, listening to people on the radio, listening to people in general, listen, times have changed. It's different, and that's what I keep trying to tell you. And I know people don't want to hear this, but I can assure you this is going to be a marathon. It's not a sprint. To take our time getting there, take a deep breath. And I know I keep saying this every day, but no one wants to put a timetable out there. But now the April 15th, the governor shut down non-essential employees. You look past April 15th and you go forward, and if you know this isn't really going to hit us for another 2 weeks, these are things that we need to address and realize probably the norm won't start for a couple months. Probably is not going to start. And I know we want to get businesses up and running, and we want to get people back to work, and we want to get back to our daily lives. No one likes change. We don't like change. No one likes change. And the only thing we can do is come together as a community and work together. And it's not going to work if people continue to do things differently and not think about everyone as a mass. And things will change. when this is all over with, that things are going to change. So we're there for you. Take a deep breath, take a step back, and be there for your neighbors, and be there for everyone else. Part of the deal with the National Guard coming in today and delivering food to people that are on quarantine and on precaution quarantine is that we're going to make sure they get their food. And seniors that are having a hard time, that we want you to stay home, we don't want you out shopping. New York Connects is going to make sure, and we got people out there delivering food and doing a great job, and we're going to continue to make sure everyone has what they need. Also, we talked about, and we continue to put it out there, the 211 number and the hotline for New York State. So please call that. If you have any questions, if you have any concerns, let us know, and we'll continue to work with you. And listen, hopefully, we're just getting into the spirit of this, and we're dealing with a lot of multiple agencies. We're dealing with a lot of localities to make sure that we get this information out to them, but to make sure we're here to protect the safety and health of our residents. That's my first responsibility. The economy will be second, and we'll make sure we're addressing that as we go forward. And I can assure the viewers too, we're dealing with our budget. We're dealing with the shortcomings of a lot of revenue not coming in now. But again, first and foremost is the safety and health of the people that we represent, and we're going to continue to focus on that first, and second on the economy and about how we're going to go forward moving differently. And we're going to have to be smarter the way we operate, which we have been. But again, I want to thank everyone, and I want to turn it over to Dr. Whalen. She has a few things to say.
Good morning, everyone. So, as you know, we continue to see our number of cases throughout the county increase, but we don't see them increase to the level that we saw when we were doing widespread community testing. This is to be anticipated. But it also leaves us a little bit in the dark about how this is evolving in Albany County. When we look downstate, we know that this is widespread through the community, and they have been able, in New York City, given the fact that there is still testing for the community, to look at what a timeline may look like. And they're talking about the apex, which is when we would get to the highest part of the curve, being in a couple of weeks. It is difficult for us to extrapolate from that where exactly we fall, but I think it's safe to say that we would be later than a couple of weeks. So we are in this for the long haul. We continue to advocate the important public health messages. And I think today, hearing from the county executive about other concerns that people face and how we can assist those from a county level is becoming more important to people as they get used to the reality of staying in their homes, of not traveling out, not going to work in many circumstances. There are a lot of other needs that are arising. And we're happy to work with the county executive and our other county agencies to help the public address those needs. As Dr. Giordano said recently, mental health is a big issue now. Those that have suffered with anxiety and depression in the past find that this may make things worse. And many people who have never had anxiety and depression are starting to feel those symptoms now. So it's important to know that this is real, and it results in a need to take care of yourself and to avail of the services such as the hotline that are available to people. At the health department, we continue to work around the clock to make sure that we are identifying cases, getting cases from other counties that maybe have contacts with Albany County residents, and making sure that those individuals are placed on appropriate quarantine and followed along. We're monitoring their symptoms, and we're advising them if they are not feeling well, what the best course of events and recommended behaviors from there should be. This remains a very active situation. I don't think people understand that we have not yet reached where we could be in the coming weeks. So the important messages to stay home, and to avoid contact with others, especially if you are in the vulnerable groups. Those over 60 or those with coexisting medical illnesses need to take particular caution to protect themselves. We remain a resource to county residents and are happy to take calls. The county website has information on how to support your own health at home, as well as the New York State Department of Health resource webpage and the CDC. We would encourage people to get their knowledge from those sources, and we continue to provide that information to the public. We look forward to continuing this. As the county executive said, it's not a sprint. This is a marathon. This is going to be the foreseeable future for county residents. And we know that this is difficult for people, but we want to encourage people to still maintain social distance, keep kids at home, and keep your family safe. Thank you.
Thank you, Dr. Whalen. And listen, I just want to remind everyone, life is, I'm going to quote this author, life is 10% what happens to us, 90% how we react to it, and it's by Dennis Kimbrough. And it makes so much sense. You know, again, life's changed, and we have to address it, and how you act today, you'll be judged tomorrow. So I do want to say thank you to the great residents of this county that are practicing social distancing and not handshaking and coughing into your arm and washing your hands. So thank you, thank you, thank you.